Good morning, good morning. I'm Dr. Dale Dangleben, and on behalf of Patient Choice in Ximenez Point, Michelle, this is your medical tidbit of the morning. What is the topic of the day? Appendicitis. Okay. What is appendicitis? Appendicitis is inflammation of the appendix. It's a small, literally finger like shaped pouch attached to the large intestine on your lower right side of the abdomen. Okay? It's where the small intestine and the large intestine comes together. The ileum and the cecum comes together. Then you have your vermiform appendix. Most of the time, it's on the right lower quadrant. Okay? And when it becomes blocked, because there's a little lumen channel inside, when that becomes blocked and inflamed, it can swell up, become infected, and even rupture if not treated appropriately and quickly, right? So appendicitis is a true surgical emergency. And if the appendix bursts, infection spread throughout your abdomen, right? Your peritoneum, the lining, that's called peritonitis. And it gets into your bloodstream and it becomes life-threatening. You get sepsis and die. So time is very essential. Time matters when it comes to appendicitis. What are some of the common causes, right? So you can have feces, stool, blocking that lumen that I talked about. It's called a ficcolith, right? You could have swollen lymph nodes tissue around that area, right, causing that obstruction, right? Certain parts of the world, parasites, and rarely you could have developed tumors in that area that cause the blockage. And once blocked, the bacteria, multiplies rapidly, causing the swelling and the infection, resulting in appendicitis. Okay? So what are some of your classic symptoms? Symptoms often start very subtly and worsen over hours, right? The classic is, the pain that starts near your belly button, right? And then moves towards your right lower quadrant. With that, the pain worsens, right? And with time, it worsens with movement, coughing, walking. You lose appetite. You develop nausea and vomiting, and low-grade fever. It doesn't necessarily have to be high-grade fever. It could be a low-grade fever, and obviously worsening abdominal tenderness. But remember this: not everyone has a textbook presentation, right? With what I mentioned above, especially children, elderly patients, and pregnant women, because in pregnancy, the fetus displaces the bowels and the appendix, so it might not be in the classic location, okay? So if you're having these types of symptoms, you want to go to the emergency department, right? And emergency room docs and family docs don't dismiss these things. Because if you send these patients home within hours, they can rupture, and you take you take a relatively easy situation, and you deal with peritonitis, not doing it laparoscopically. You have to do open procedure, having to put drains and all this. It changes the whole management, right? So go to the ER if you have worsening abdominal pain, pain that localizes to your right lower quadrant in your abdomen, right? Worsening fever, you're vomiting, and you cannot walk upright due to the pain, all right? Do not use heating pads. Do not take laxatives, right? Delaying care, hoping it will pass, all right? So get to the ER, and for the doctors, good examination. Get the blood work right away, right? Check the white count, check the lactate, right? Imaging, CAT scan is what's most commonly used. You could use ultrasound, especially in children and in pregnant women. But even then, sometimes the appendix is hard to visualize. All right? The standard treatment is surgical removal of the appendix. You will read some literature, especially out of Europe, where you could manage this with antibiotics without surgery. But again, you don't want to take this gamble. I still recommend surgical removal of the appendix, which is called appendectomy, right? Most surgeries are done laparoscopically. I don't remember the last time I did an open appendix. I've been able to do this laparoscopically for the last 10, 15 years, all right? Recovery is rather quick. Usually, Appendicitis that's not perforated, the patient goes home the next day with antibiotics. Or if they're perforated, it's there a few days, right? We might leave it draining and things like that. But surgery is the gold standard, all right? Some uncomplicated cases, like I said, if you read the literature, they said you can manage with antibiotics. But again, I would say, in places where you don't have a lot of antibiotics and medications like that, just go ahead and do the appendectomy and get it out. The standard small right lower quadrant incision like they used to do before laparoscopy. If you don't have that, if you don't have a laparoscopic setup, you can get that done relatively quick. All right. So the key here is right lower quadrant pain plus fever is equal appendicitis until proven otherwise. And if you delay your care, that increases the risk of rupture and complications. All right? So appendicitis doesn't wait, and neither should you. If your pain is worsening and you don't feel right, trust your body and get checked. Early treatment of appendicitis saves life, and I will leave it with that today. Have a great day. Peace.